Okay, so now we're going to start here on the forehead. I'm going to take some of my Lift gel and apply some into the area we're treating. And there's a few tricks with doing this that I want you all to be aware of. So with the pen, you're going to turn here to a 0.25. I want everyone to realize the end of this pen is a little bit heavy where the battery sits, so sometimes it's easier to tilt to each side, kind of lifting the needles off. So make sure that you're always making full contact. That's what I mean by full contact with the skin, following the lines and the rounds of the skin, not halfway tilting off left or right, and that you're moving at a medium pace like this. So again, like I said, people moving very quickly, doing large areas, it's like you're skipping rocks. We want to make sure all of those needles have a chance to hit. And so we're doing this, we're going up and down, side to side, then filling in with some slow one-directional circles going about this pace. So I'm going to turn the device and we're going to start. I'm going to show you how when I'm doing the forehead, to provide a little padding, I use a lot of pressure with my hand that is not needling. So I push down on the skin and I'm pinching up slightly to add a little bit of padding to that bone. So I'm going to begin. So I'm just adding a little pressure, a little with my hands here, going at like a medium pace. Filling in with some slow one-directional circles. Now, if your client has a higher, bonier forehead and you want to work in the line, just maybe dividing up, and I sometimes will just do 2 passes, you know, along the hairline, up and down, and side to side. So now we're going to go over to the other side of the face. And I'm going to squeeze up this way, using some pressure here again with my fingers, adding some padding as this area usually tends to be the boniest on the forehead. I try not to lift up as much as possible as I can on the skin, keeping the pen always down because the body then can get used to the sensation. Lifting up and down and on and off can be very uncomfortable to the patient. I'm going to have you just move your head this way, thank you. Adding a little more gel. You can see how I'm snaking along, attaching, and now let's go right into the crow's feet. So I'm moving into the crow's feet area, spreading the skin out, like I said, using a lot of pressure with my fingers, not with the device, just letting the device, making full contact and letting it do its thing. I'm going to go ahead and do the crow's feet on the other side here. You don't need tons of slip. Just a nice even layer, medium layer is fine. If you go through too much of the lift, the client doesn't have much to go home with, and it kind of will add a lot of goo into the cartridge, which is annoying for some people. So I'm going up and down, side to side, and filling in. So in here in the bone here, and here is where we're going to work next, like doing this area here. Moving in more. So here is where like the 11s can start in here, and women will get bunny lines in there that they want to work. It's very hard when you're working in here doing this kind of a treatment because it can hit the bone of the nose and you can get petechia and stuff. So much easier to use your hands, pull up, and using pressure. I'm using heavy pressure with my fingers, and I'm going to go side to side. Sometimes people get scarring in there as well and they want to get that. So I'm just going side to side in this area, holding up and working out, doing the 11s. You can see a nice erythema. And then working down here along these sides. So lots of, usually if people have acne scars or things are in here, enlarged pores and stuff. So what I do is holding on this side, I use some pulling tight, making a tent in here so I'm not going over the bone. You never want this device going over the bone. It hurts. Like I said, you can cause petechia and pressure. So I hold here to where like the sinus is, and I put some pressure here, making a tent. So it helps with any discomfort and also keeps the needles from vibrating along the bone, which is what you want to do, because usually people in here will get a lot of acne scarring, residual acne scarring, large pores. So I'm going over there using pressure and hitting that area. When I go into the side of the nose, I pull over using a lot of pressure because that can be a very sensitive area, and squeezing. So I can work in that area in there. I'm gonna go ahead and do the same on the other side and doing the other side of the nose. Again, holding some pressure here, tenting out, working up along to the bridge of the nose and back down. Pinch over to the side. Working there, and then pulling up. Sometimes this area can be slippery, so sometimes I have to remove some of the lift gel and pull up, or sometimes you can take a little dry gauze as well. And you want to make sure you get enough tissue here like this, because you don't want to be running over bone. But if I get enough tissue, I can go over the top of the nose, side to side, and doing some slow one-directional circles in there to really get into those pores, because that's what people want. How now when I work in the face, I consider the cheeks, like we were talking the face mapping, the cheek, the upper cheek area, she's pretty thin, not a lot of subcutaneous fat here, and has nice high cheekbones, so sometimes there can be some discomfort. So I'm just going to take my finger and push up a little bit like this and just put a little bit of padding here. Always move the client's head with you instead of you always trying to bend around them, can make it ergonomically. So I always just kind of tell clients I'm going to move your face around while we're doing the procedure, that way you can get a better angle, and typically it's more comfortable for the client. Again, I'm just still doing this treatment. I've done her entire treatment at a 0.25. So I'm just going to pad up here and going over and following the rounds of the skin and the cheek area. You can even take this finger and pulling out, stretching the skin and using pressure, snaking, and then filling in that area with some slow one-directional circles. She's going to get some really nice results here. A lot of times too, people will get acne scarring in here. Sometimes you can pinch that out to kind of pop the scar out, and you can work doing some more slow one-directional circles around the acne scarring to help kind of soften that or lessen that, because sometimes if you're trying to just push the pen in, it's kind of hard if it goes like this. So sometimes just popping it out a little bit is really helpful. So I'm going to go ahead and do that on the other side as well. A little bit of acne scarring in there for us to like this, and holding very nice. And you don't always have to hold the cheekbone this way, but I find that it is nice for some clients, depending on, you know, the shape of their face, to add that little bit of extra padding. And then go ahead and pull nice here. And let's pop out some of this scarring and do some slow one-directional circles. Okay. So now after I've done the upper face here, I move down to the lip. What I kind of find helpful is to just kind of use pressure with my fingers and just slightly pop the lip out. Sometimes if people have a deep wrinkle in their lip, let me turn off for this. If they have a deep wrinkle, I'll kind of pop it out in there and sort of work in there, but just kind of popping out a little bit like that. We're in the home stretch. So I'm just going to pop out here, going just up to the vermilion border and back. And then in the center of the lip, I always pop this out because it can be a very uncomfortable place. Sometimes people will have scarring in there. Doing that, and then I'm going to go ahead and pop this out on the other side. You don't want to go too deep around the mouth. You want to watch that because there's a lot of nerves endings here and painful, and we don't want to be going at too deep of a depth that we could bother that. Can I have you do this with your having the client kind of flatten out and cutting in half? People get very hung up on depth with microneedling procedures, and it's not as important because you think the epidermis is very thin, maybe half a sheet of paper. So when we're in these lower depths, we're where we need to be in the skin. So if you're kind of overshooting your target, you're working too deep, you're just going into subcutaneous fat and bone. So it's more proliferation and how to use the skin. So by just slowing down, working thoroughly, in these areas, dividing in half. And then I'll do the other side, working in there and pulling down and sometimes pulling to the side. So don't get so caught up on depth. Look more for target, like am I working in too large a sections? Am I going too fast? Am I not making full contact with the cartridge to the skin? Things like that, and slowing down. Maybe adding in an extra pass if you feel the person isn't hitting exactly the erythema you want, or maybe you're worried that the target needs a little bit more work. You can go ahead and add an extra pass. You don't always have to go up in depth. But if you do those things and you feel like your client needs more, then you can turn it up going in between. So this is 0.25 clicking to 5, 0.75 and 1. So you can work in between here too on these. So we're going to go ahead now. We're in the home stretch. We've done all of this, and all we need to do is the lower areas of the face here. So again, I'm going to have the client move. Some women talk about this is a very hard area to get erythema. Women, you know, our face falls front and forward as we age and tend to get fat padding here. So if I put the head to the side, holding really nice and taut here, stretching the skin out, and I work, dividing this in half so I make this area one area. So again, I'm holding nice and taut here, turning the pen on. I'm still at my 0.25, and I'm working in this area. Sometimes in this area I'll slow it down a little bit. Like I said, staying in a small section here. And then I'm just moving along, rubbing a little cream here, starting along the ear. Working out, I only go up to the cheekbone and down. I never want to go all the way up to the cheekbone. I just go up to the cheekbone and down. That's how I know where to make my square. And I'm filling it in with slow one-directional circles. And then sometimes too, if they have a very prominent jawline, the jawbone can hurt. We don't want to go over bone. So I'll just slightly pinch up or lift up, going along the jaw. In that area, so we have a nice even erythema. And then we'll do this side here, and again, you can see me doing this area in this fat pad. She has some acne scarring here, some post-inflammation from that, so we'll work in that area as well. So just holding taut up to the cheekbone and down. I'm slowing down with my device, I'm working more thoroughly. And then I'm pulling up here on the jawline, circling around. So here we have some nice even erythema. So don't do what I call chasing the white. Some people's redness is more delayed than others, and that can be just because of genetics and the way their skin is, to if they're on certain kinds of medications or other things that can change the histamine response. So what I do is I just work thoroughly in my sections, going from section to section, and then I don't go back and keep treating, because you can over treat until the end when I look and kind of see if there's any areas that I've missed. She has a little bit of blotching here. I think that's kind of the histamine response, but the rest of it is nice and even. So I've had sometimes where people just don't seem to be getting erythema, but by the time I get to the other side of the face, they're nice and pink. So this is perfect. There is a little bit of blotchy whiteness here. If somebody wanted to, they could maybe just lift up here like this, just pinching together and do a little pass here to fill that in. I'm not going to, because I think she looks very well treated to me. But that kind of answers that question. But this is a nice result. Erythema, no bleeding, no need to go too aggressive. She's going to get great results. So I'm just going to take some wet gauze, and I'm just going to clean up her skin and then reapply some of the Lift Hydrogel. For information on your post-procedure protocol, like I said in the beginning of the video, please refer to your medical director or office manager to get those post-procedure instructions. So thank you for watching this video today, and I hope it's helpful and you learned something about how to perform a thorough SkinPen procedure.